What is a stroke? A stroke is a type of cardiovascular disease that affects the arteries and those blood vessels that carries blood to the brain. It occurs when one of those blood vessels ruptures in the brain and the blood is floating around. When a person is affected by the stroke, it depends on where the stroke happens in the brain and how much brain damage there is. For example, someone who had a small stroke may only have minor problems, such as temporary weakness of an arm or leg. People who have larger stroke could end up permanently paralyzed on one side of their body. Surgery. When surgery is being concerned after a stroke, your age, overall health, and current condition are major factors in the decisions. Sometimes when stroke happens to a patient, they have trouble communicating again. This is called aphasia. If you have aphasia, you may have difficulty in expressing yourself when speaking, trouble understanding speech, and difficulty with reading and writing. However, aphasia is not a disease. It is a huge symptom from the brain damage that happened from the stroke. Nutrition. Good nutrition is extremely important because it leads to a good, healthy lifestyle. Combined with physical activity, your diet can help you to reach and maintain a healthy weight. Not only is it good for your health, but it can reduce health complications. Also, it can reduce your risk of chronic disease. For example, it can reduce some type of cancer, high blood pressure, high cholesterol, heart attack, or stroke. Eating a low diet in fat and salt, high in fruits and vegetables, reduces the risk factors for another stroke. In other words, nutrition is more important than exercising. Nutrition is 80% and physical activity is 20%. Treatment. Treatment can be given with drugs to break down clots and prevent others from forming. Only 20 to 25% of patients who are taken to the hospital with a stroke arrive in the emergency department within 3 hours of the onset of symptoms. Aspirin can be given as an injection of a tissue activator, which is TPA. TPA is ineffective at dissolving clots but needs to be injected within 4.5 hours of stroke symptoms starting. Outcome. Stroke is one of the leading causes of long-term adult disability. It affects 795,000 people each year in the United States. Early recovery and rehabilitation can improve functions and sometimes significant recovery for someone who has suffered a stroke. Rehabilitation programs are particular for motor performance and stroke survivors. Some individuals usually end up doing physical rehabilitations after a stroke because not all motor functions recover. For example, motor skills exercise can help improve muscle strength and coordination. Mobile training is learning how to walk again but needs some assistance, like using canes, wheelchairs, or ankle brace. The whole purpose of this program is to help you relearn the skills that you have lost. Rehabilitation can also improve your quality of life as well. Medication. The medication is to reduce blockage in the arteries from blood clots, lower blood pressure, and lower cholesterol levels. Patients can take blood thinners, statin, and ACE inhibitor. However, majority of people said that they took the medication because it was important to avoid having another stroke. One person prescribed their medication as a lifesaver.